standards in the area of health. Just as I go in, I would just like to bring to your attention that in 2020, when you look at all the ISO standards that were reviewed, health itself took 6.8% of all the reviews that were done for ISO standards. So the element of health is of great interest to all the sectors that are actually out there. So we've stayed abreast with what is going on in that area, and this is our 22nd webinar on ISO standards. So for today's outline, what we have is we have a slide on the presenter. We'll talk about the AG group, which is AGHPF and AGQC. And then we'll talk about the International Organization for Standardization, not the IOS, but the ISO. And we'll talk about the technical committee route. In this particular case, the technical committee that we are referring to is the TC212, and how the green how documents get developed under the ISO structure. Then a quick overview of the ISO 15189 2012. That's the third edition, which was released in November of 2012. And then this is what everybody's here for, I know. We'll talk about the ISO DIS 15189. And at such a point, we will find out what DIS is. Oh, by the way, why don't I just let you take this as the initial challenge? If you could just go into the chat box and you could tell me what DIS stands for, I'll be very glad to see how many people actually had the right answer. So just go into the chat box just before we get started and type in what you think DIS stands for when we talk about ISO DIS 15189. And I'll get back with you with the answers as we go forward. So again, welcome. Good morning, good afternoon, good evening, depending on where you are in the world. Our 22nd webinar on ISO standards, this time introducing what is going to potentially be the 4th edition of ISO 15189. My name is Killian Songwe. I have over 25 years of management systems experience, done this internationally on a number of the continents. I am a project management professional myself, and an adjunct professor of health administration and public health in the Washington, D.C. area. So what I'm going to look at now, this is our management team here, part of the management team at the AG Group. We've been around for almost the last 18 years on the 3 different continents, helping different sectors, especially the health sector. We are ourselves certified to a number of standards, the ISO 9001, the 14001, and the 45001, which replaces the OSHA standard. And we're looking forward to being certified on the 27001, which is information management systems. As you all know, everything is gone digital following the COVID pandemic. Our clients, there are many and big. We've worked with almost 16, 17 ministries of health on the African continent. We've done a lot of work with WHO, AFSO, the CDC, both in country and Atlanta, and a bunch of a number of the other organizations. I just show you this just to be able to show you the breadth of our work and what we've done in the area of standards over the last 18 plus years. So going into ISO, this is a picture which I love. You know, this is one of those very historic pictures. This is a picture of was taken in London in 1946. These were the founders, you know, the founding fathers. And indeed, this is a picture of founding fathers because there was not a single female in the group. So it's truly a group of founding fathers taken in London in 1946. What we had in London was 65 delegates from 25 countries got together to discuss how they could internationalize standardization. And that was 1946. The next year, 1947, they actually got together and the launching of the International Organization for Standardization. This is a very interesting picture because when I fast forward to 2021, this is what you have. Much younger sets of people, not as stern as the people from 1946, but very diligent sets of people. And it does me a lot of pride, the the gentleman whom I circled down there, that's Eddie Jeroge, who is the president of ISO. He's a Kenyan by nationality. And what has happened with ISO in the last 75, 74 years? They've produced over 24,000 standards. They have 165 members. Just remember in 1946, 1947, when they began, there were only 25 countries represented, 65 members. In the last 74 years, it's 165 members, and each representing a country. And we have 802 technical committees. And these technical committees are very important because I'm going to spend a few minutes talking to you about the route which the technical committees take to develop an ISO document, which is called a deliverable. So the technical committee route for developing a document, and this is important to know as we are talking about a new and a potential fourth edition to the ISO 15189 for medical laboratories, requirements for quality and competence. Traditionally, what you have before you get a new product in step one, you have new work item proposal, which is presented. Then there's the building of the expert consensus. These are people who have used the document, who are familiar with the sector, people who understand what the intention is when the product becomes developed. Then there is consensus building. So it means there is a draft document that goes out, people review it, and it goes through the 165 members. So each country actually has a member, which will be the Bureau of Standards, depending on the different countries in which you are in. So you have consensus building within the technical committees. And then this is where we are today with the ISO DIS. And at this point, I'm going to blank out for a few seconds because there are some people who are cheating. How many of you have responded to what was the DIS? What is DIS? I'm going to wait a few seconds for my technical team to tell me how many DIS response do we have. So we have four. We have four people who actually got the DIS. The DIS stands for the Draft International Standard. So you talk about the ISO DIS. So it's ISO / the Draft International Standard, which means it is not yet available. It is still being looked at. And this particular standard, all the draft standards, they have 12 weeks during which they go through a voting process. There's a voting process that happens. And then after the voting process, you're in stage 5, the formal vote. The final draft international standard gets voted on, and then there is a publication. So in these 6 stages, there is actually a stage and a sub-stage enumeration. A stage and a sub-stage enumeration that goes with each of the documents. Now, you wouldn't see these enumerations on a published document, but when you go onto the ISO site, and some of you might be familiar with going onto the ISO site because you're looking for a document, you want to download a document, you want to buy a document. It is very important to understand the stage and the sub-stage of the document so that you download and or purchase the appropriate document. So if we took the ISO 15189, this current one, what you see I have highlighted in yellow, the stage is 40 and the sub-stage is 20, stage of main action. So this particular document is a stage 420, 40-20, which means there's a draft international standard which has been initiated and it is during its 12 weeks of voting. So the voting in this case started sometime in October and is going to expire in January of 2022. If you were on the ISO site, you would also see a document that is called 6060. And the document 6060 would be ISO 15189-6060. That would be the 3rd edition because that's an international standard that has been published. And that is one which if you purchase, you would actually be very current. So there is a draft document which would be nomenclatured as 4020. And then there is a current document which will be nomenclatured as 6060 because that's been published. It has gone through the 5 steps. However, on the same ISO website, you could also see this 1992 for the 3rd edition, which basically tells you, and this is how you know that one of the ISO documents is under revision. So if you went to the ISO site, you would see an ISO 15189 nomenclature as 9092, which basically says this particular international standard, the third edition in this case, is being revised. And this is where its revision stage is. So when you look at that revision stage, the next thing that is going to happen is that the international standard becomes confirmed, and then the 6060 of the third edition becomes withdrawn by the technical committee, and then we have a new 6060, which will be the fourth edition. So in terms of nomenclatures and in terms of appreciating what the level is of the document when you go to the ISO site, because by the way, the documents might be on the ISO site at different stages. So for example, I just purchased the DIS document. It is on the ISO website, but I cannot use that document because it clearly says it is a draft international standard. And now without appreciating this nomenclature, you could potentially purchase or actually acquire a document which is actually not in use. So it's important to appreciate the nomenclature that ISO uses for its documents and when those documents are ready for the public and in what stage they are actually available to the public. So we go to the overview of the third edition. This would be the 6060. It's published and it's available. All ISO documents have the same three primary clauses. It says what is the scope, what are the required documents, normative reference for using that particular standard, and then what are the terms and definitions that you must know to be able to appreciate using that document. But this is what most people know about ISO 15189. They know the management requirements. Most people say there are only two clauses in the third edition because they talk about the management requirement and they talk about the technical requirements, and somehow they just forget that the scope and the normative reference and the terms and definition actually constitute a part of the entire ISO. So in terms of its layout, the management requirements of the third edition has 15 sub-clauses, starting with organization and management and down to advisory services, resolution of complaints, and on to management review. The form most of what we know as the management requirements. And then the technical requirements, which moved in the third edition. The first edition of this standard was actually in 2003. So we moved out of ISO 17025 into ISO 15189 in 2003, and then into the second edition in 2007. And then between 2007 and 2012, we go into the third edition. And then between 2012 and now 2021, there is the potential of a fourth edition in 2022. I actually just looked up the ISO website to see when the TC212, which is the technical committee that is responsible for this document, to see when they're going to be sitting next so that I could gauge, but I could not find an exact date on the calendar of meetings for the TC212. So it's going to be an approximation when they will be sitting in 2022, and for us to be sure that we have a new edition. So that's the layout of the third edition. So we go into the draft international standard, the ISO DIS 15189. As I mentioned earlier on, it's the technical committee 212. That's the technical committee that works in health and that works on this standard. They have so far produced 45 different products, 45 different standards that cover everything from molecular testing to point of care testing to in vitro diagnostic testing. And they currently, as I speak, are actually on their way. They're working on another 21 more standards. So all going well, we are looking at somewhere between 45 and 61. That takes us to about 67 different standards that the Technical Committee 212 is working on. And the secretariat for this is the ANSI. The standard is the same, medical laboratories, requirements for quality and competence. That hasn't changed, nothing has changed there. I mentioned that there is a 12-week period for voting, started in October of 2021, and it's going to terminate on January 11th of 2022. And then we would move into the FDIC and then be able to move on to a new document. So this is much different from the third edition. The fourth edition, the potential fourth edition, I should say, because it's not published yet. So I cannot officially call it the fourth edition. But the potential fourth edition has the traditional scope. It has the normative reference. It has the terms and definition. And then this is where it comes in, and this is where it's new. And let me just quickly make a quick disclaimer. I'm not training on the new potential new standard. I'm just going to I'm making a presentation on how the next edition of the standard is going to look and how different it is from the third edition. I must tell you, as somebody who has been working with this standard for the last 18 plus years, that the current and potential new edition is going to be so much easier to use. It's going to be much friendly. There are a number of things there that some people who have been through our trainings would have heard us say as suggestions to the new standard. So you look at this, it says general requirements. That's the fourth clause. General requirements, we're going to look at that. It says structural and governance requirements. Structural and governance requirements. And then I guess you could take a good guess what will be under resource requirements. Just in our general everyday, there are the things we call resource. And then process requirements. This, when you look at the third edition, when the third edition came into being, it actually moved from pre-analytical, analytical, and post-analytical phase, and it actually introduced the word processes. So it spoke about examination processes, and there are 3 times where it talks about that. And that whole idea moves into the potential fourth edition when it talks about process requirements. So it allows us to be able to take all of that and put it into one place and work with it. And then management system requirements. When you look at this layout, when you talk about process requirements, you talk about management system requirements. Basically, what you're also looking at when you also look at structural in 5, you begin to see, for those of you who have interfaced with the ISO 9001, the quality management standard, the model of all quality management documents, you begin to see how issues of leadership, issues of structure, issues of operations come into being, and the relationship between the ISO 9001, the ISO 15189 third edition, and the potential of the fourth edition, and how it all comes into being, and how the different things are structured and actually laid out. So, just to open up, one of the big interesting things on the new standard is it says this document includes requirements for point of care testing. Most of you would know that point of care testing actually has a standard of its own. But now in the new standard, it has actually taken into consideration point of care. So as we work on this, you could actually be able to very easily implement this at your point of care sites. It talks about the normative reference. The big change on the normative reference actually is on the 17025. When I gave you the chronology of the history of the standard, it actually truly starts with 17025, and then it goes into 2003, where you have the ISO 5189, and then the first edition, and then the second edition in 2007, and then the third edition in 12, and then a potential fourth edition in 22. So here on the normative reference, the 17025, the previous edition was the 2015, and for this document, they are now referring to the 2017 as a normative reference for using the ISO 5189. Terms and definitions, I wouldn't spend much time in it. This is pretty chronological with all the ISO documents. But my diagram to my right, which will be your left as you watch, it talks about your space, it talks about a boundary, and then it talks about their space. Basically, what you're looking at here is a true definition of the word scope. What is going to be in our space in the scope, and what is out of our space, and where is the boundary. Clause 4 talks about general requirements, and this is just the requirements that you will need to be able to appreciate and use the ISO 5189 fourth edition when it comes into being. And the very initial things that it looks at is, how are you going to show impartiality? How are you going to show impartiality? How is the element of confidentiality stressed? What are the requirements regarding the patients that your institution, your laboratory is going to put into place to ensure that your patients are comfortable, they can be satisfied with the confidentiality that is going to be used, and they can feel free about the fact that they're going to be treated as the next number on the line and not the relationships that brought them to the facility. And I throw in the diagram that talks about respect. Of course, we do have to respect our patients. We do need to show a lot of integrity and honesty and a high level of ethics when we're talking about the general requirements. And this basically translates into the third edition when it goes into the opening and it talks about the structure of the organization. In clause 5, and we're going a little quick here, in clause 5, it talks about structural and governance requirements. And in that clause, it has 6 sub-clauses. It talks about the legal entity. So when you, just by looking at the headings, you talk about the structural and governance requirements. Just by looking at that heading, you instantly see what comes to bear. You talk about the legal entity. Is it a standalone laboratory? Is it part of a bigger organization? Where is its place in that legal identity? And then, of course, it talks about the laboratory director, this time in clause 5. And then what are the activities that this laboratory is actually going to be carrying out in reference to scope? So if you're going to define the scope, and then you come into activities and then they do not flow, we're going to talk about non-conformities and those kinds of things when we go down. So this is a true relationship to be able to ensure that when you define the scope and you talk about your laboratory's activities, we can see some synergy, some flow. It talks about structure and authority. In the previous standard, we had the element of responsibilities, we had the element of roles and authority, and here it talks about the structure and the authorities that are vested in those structures. It allows for a very good communication and exchange of ideas within the group. And then it says objectives and policies. So again, this comes up earlier on in the third edition, just before we talk, or just right after we talk about the role of the quality manager. Here it talks about objectives and policies. But this is where the big change comes when we're looking at the potential new edition, when we talk about risk management. Risk management in the third edition, I think it's about 3 lines. I think it's barely 1 sentence when we talk about risk in the third edition. In this edition, risk shows up in clause 5, it shows up in clause 8, and it constitutes about 4 sub-clauses. And in a sense, and I might repeat this later, it actually deletes what would have been clause 4.11, which is preventive action in the new standard. This standard doesn't talk about preventive action, it talks about risk and opportunities. And so I threw in this diagram because this is what risk is truly going to mean when we're talking about ISO and ISO 5189. We're actually talking about what's the severity and what's the likelihood of that event happening. And then what can we do to eliminate that event or reduce the consequences of that event happening? And in essence, that is a preventive action that is going to be taken. So in this standard, it actually removes that and it goes straight to talking about risk. The clause 6 talks about resource requirements, and this is one of those ones that is very interesting. When you look at resource requirements, 5.1 in the third edition, the first thing that jumps into you is personnel, and we talk about all the things about personnel from their records to their space and all of that. When you talk about resource requirements, of course, the first thing you're going to think about is the personnel. And just in its own appellation, resource requirements, you can actually say, what are the resources that you're going to need to be able to put out a reliable and timely result? For you to be able to have a reliable and timely result, yes, you're going to need personnel, you're going to need a good facility, you're going to need equipment, you're going to need calibrated equipment, you're going to need traceable and meteorological equipment. Those are just the basic things. But again, in terms of the appellation of the clause, it is easy to begin to align to the new standard than it was in the old standard, where a couple of things were all over the place and you kind of sort of had to tie them in. And so I throw the picture because since the COVID in March of 2020 or December of 2019, our work world has become very versatile. So this is what a lot of us have known the work world to be: many more hours in front of our computer screens, just waving at our friends from halfway across the world. I miss my good evening dinners when I travel to all the different parts of the world, because now I'm stuck in one place for so many days and so many hours. Moving on to resource requirements, then you have reagents and consumables, service agreements, and externally provided products and services. So these are all the resources. When you're talking about resources here, you certainly need reagents to run the equipment, service agreements to maintain the equipment, preventive maintenance on the equipment, and then externally provided products and services needs to be in place. You need to know who is going to provide them, and what is the frequency of events that are going to happen to ensure that your management system is as robust. At the end of the day, the standard goes back to a very simple thing. It says you need to be able to provide reliable and quality results for the patients and the clinical personnel responsible for the care of the patients. So when you think about the resources that is going to be able to provide good quality results for the patients and the clinical personnel, they are listed here. So you could pull your resources in one place. You could actually come up with a very nice binder that takes care of your resource requirements. And that in turn helps you cover up on a number of things. Process requirements. This is a big change. This is a big change. In this, we are looking at the pre-examination processes from the point where the patient goes to see the doctor and the sample gets ordered, the examination process, and the post-examination processes. All of those processes coming into play under process requirements. And I just threw the picture of this sample, a COVID sample being collected, because most of you must be like me. I don't know how many times people have gone on a journey up my nostril, but I don't know if it's painful. It's now beginning to be ticklish, and I'm having a good sneeze every once in a while, which I need, by the way. Pre-examination processes, examination processes, and the post-examination processes under the process requirement. But now look at the next 4 things that follow. It talks about non-conforming work. You need to actually be in the examination process to have non-conforming work. This is control of data and information management. Every time that an activity is actually carried, then it must be recorded. What actually happened must be recorded. So when you control the data, you will be actually controlling data that comes out of an actual process, whether it's the pre-examination process, the examination process, or the post-examination process. Then, of course, when you look at the introduction of the standard, it talks about the patients and the clinical personnel responsible for the care of the patients. So there are going to be complaints because we're dealing with human beings. There are going to be complaints. And as technicians ourselves, technologists, scientists working in these laboratories with the different equipment, we might have complaints about whether it's internal or external, to do with our own equipment or to do with our clients, which could also be internal clients or external clients. Those complaints need to be addressed. And it talks about continuity and emergency preparedness planning. The whole element of 4.12 in the 3rd edition comes up here twice, because when you talk about continuity, ensuring the suitability of the system, but you're also talking about continual improvement of your system as you go forward, and emergency preparedness and the planning that is associated with that. So clause 7 is really the meat in this new standard. In the old standard, we would always have said clause 5, which were the technical requirements, actually absorb a lot of the meat, because it started with the personnel, and then it go on to 5.4, and then which is the whole collection process and having a manual that talks about collecting the sample and transporting the sample, and then the testing of the test now of the sample, and all of that is brought into process requirement here. And then this is technically the last clause of this standard, of the new standard. It says management systems requirements. management system requirements. What are the general requirements and options that you have in setting up your laboratory and in doing the work that is related to it? And then it talks about the management system documentation. The management system documentation. How is this system documented, and where are you going to find this information? So you're looking at the management system, and you're talking about the requirements for this management system. And you could clearly come out with a binder that actually says, for this management system, which actually addresses quality and competence in a medical laboratory for in vitro diagnosis, not in vivo, in vitro diagnosis. This is what our management system documentation looks like. And when you look at the subclause 3 and subclause 4, they relate to what would have been clause 4.3 in the third edition and clause 4.13 in the third edition, which would have been records, control of records in 4.13 and document control in 4.3. So all of that is brought into your management system requirements because it defines how the entire management system is going to be recorded and how it's going to be controlled. And then it talks about actions to address the risk and opportunities. Remember when I was in clause 5 earlier on, I did speak to the fact that this particular standard actually has made risk management pretty important. And most of the ISO documents going forward, as they go through revision and go through a new publication, the element of risk is going to be very accentuated. So the whole element of risk is going to be looked at. There is a whole standard on risk management. One of the ISO documents is on risk. And a lot of the elements in that standard is beginning to be reflected in the new ISO standards and ISO documents as they become available. So in subclause 5, 8.5, what you'll be looking at is what would have been your traditional preventive action. Well, how do we address risk? And I showed you a metrics in 5. And what opportunities come from addressing those risks? So how do we ensure that the potential non-conforming event will not happen? Because if we go through the risk metrics and we can actually itemize all the potential risk that could happen in our system, from whether it's a huge amount of samples coming in, to an equipment breakdown, to staff not showing up. It doesn't matter what the risks are, but there are potential risks that could show up in different settings. And once we can identify that risk and we put it into our risk matrix, and once we put it into our risk matrix, the next automatic question that comes up to mind is, how do you eliminate that risk, or how do you reduce the risk? There are some risks you can do absolutely nothing about, but you want to watch them so that you know how to react when that time comes. So management systems requirements goes all the way through 9. And then the next part, it talks about improvement. This is the same improvement that is associated with continuity and emergency preparedness. How are you going to ensure the suitability of your management system under the current standard, ISO 15189? This is going to be the 4th edition. And then there is corrective action. Corrective action certainly comes from the fact that you had non-conforming work in process requirements. If you have non-conforming work in 7.4, then you are going to have corrective action. When I saw this and I was working with this, I had a big smile because just a few weeks ago, we were running a training on CAPA, corrective action and preventive action. And that training was very good when we did it. It was an excellent training. But in another few months, we will not be able to run a training on CAPA because it's going to be corrective action and risk management, because risk management absorbs preventive action. But then corrective action is going to have to be properly defined in your system and how it's going to go, evaluations. And in the 3rd edition, we talk about evaluation and audits. In the 4th edition, audits as well sits under evaluations. These are internal audits to your management system. And the requirements of this management system, of course, once you have the evaluations, this takes me back again to the ISO 9001, the quality management standard, which is the model of all quality management documents. In the ISO 9001, when you look at the PDCA cycle, the plan, do, check, and adjust, we prefer to say adjust at the foundation as opposed to saying act. When you look at the PDCA cycle, When you look at the P for planning, it also goes with policy. You are going to plan because there was a policy, and that policy is addressed when you are looking at the resources. And then there is something that is going to be done. You're going to do that with SOPs when you're looking at your document requirements. And then there is going to be an evaluation of what you've done because there was a policy, there was a standard operating procedure, there were events that were actually carried out, there was a leadership that was responsible for the policy to come into being, there was a structure that was supportive of the organization. This is ISO 9001. But I'm saying all of that to show you how much influence ISO 9001 had on the development and revision of the ISO 15189. So if you're familiar with ISO 9001, it becomes so much easier to be able to think about how are you going to realign and how are you going to restructure your 15189 so that you are in good shape and ready to go. Then, of course, everything that comes out of the evaluation process, how you are going to identify your non-conformities, 4.9 of the third edition, goes into the management review. And at the management review, there are decisions that are going to be made, and those decisions are going to affect the suitability, and they're going to look into the policy and the objectives of your laboratory or the entity that houses your laboratory. So again, I think the big take home on this slide, in spite of everything else that I've said, is CAPA was good. It was nice to say CAPA, but now we're going to have to learn how to say corrective action and risk management. So it's going to be CARM going forward. It's not going to be sweet and juicy as they might say CAPA. Now it's going to be CARM, corrective action and risk management as we go forward. So in terms of presentation, these are the 8 clauses that constitute the potential 4th edition of the ISO 15189. As I said earlier on, I am actually not going to be giving a class or a lecture on the standard itself. We're going to keep that for when the ISO becomes the notation becomes a 6060, which means it's published and known, and then we can go into a full training on that. So what can we do for you? Now that we're telling you that the standard is on its way and it's coming out, there are a number of things that we can do for you. We can provide training as soon as the standard becomes published. We could provide training on all of these elements, on the 8 clauses, make them familiar and useful, show you a comparison between the 3rd edition, the 4th edition, some of the things that have left from the 3rd edition that are no longer in the 4th edition, or some of the nomenclature and or language that has changed. In this edition, it talks about validation of methods. It talks about verification of procedures. That's a very important change, a very, very important change, because that's something that has posed a lot of challenge to a lot of my laboratorians who are out there between when are you doing validation and what are you actually validating. So there is the verification of procedures, and then there is the validation of methods. There are the issues around measurement uncertainty. We'll be glad to provide training in that area. And then, of course, help laboratories who are not looking for accreditation, just align themselves. But for those laboratories that are already accredited, it is the requirement of all accrediting bodies that once there is a new standard or certification body, depending on what you're doing, that you are going to realign to the new standard. And one of the big requirements is that you present a transition plan to your accrediting body. This is for accredited laboratories. So we'll be glad to have that conversation with the accredited laboratories that are out there, help them look into a transition plan, how they could start talking about the transition, how they could develop it, and get ready for their next surveillance assessment, depending on where they are in their process. So again, I never like to come to an end of one of these without telling you to be safe, ensure that you keep your temperatures right, wash your hands for at least 20 seconds with running water and soap, sanitize as often as you possibly can, and please continue to wear a mask, vaccinated or not. Please continue to wear a mask and respect the social distancing that is required to keep us safe. At the Agqc Group, We are 100% vaccinated, so we're very excited. I just have a few pictures of some of our associates going through the vaccination, from fear to excitement to joy. These are all the kinds of images you get when you go out to get the vaccine. I strongly recommend that you get the vaccine. I strongly recommend that you get the booster, and I strongly recommend that you stay safe. You may or may not believe this, but we are in December of 2021. And I know most of you still think it's December of 2020. Merry Christmas and a Happy New Year. In warm appreciation of your friendship and partnership during this year, here with our best wishes for a happy holiday season and a great and successful New Year 2022. Signed off from a Global Quality Consultant and a Global Healthcare Corporate Foundation. At this point, I would stop and I would take any comments. I don't know if I can take questions because I do not work for the ISO. So I don't know if I can actually take questions, but I will try if there are a few questions. But I'll be very glad to entertain some comments at this point. Thank you. You just raise your hand, go onto your tools and just raise your hand, and then I'll be able to call you up. Yes, Frederick? You might want to unmute yourself and speak up. Frederick, you're still mute. Can you unmute yourself, please? Just tell us where you're calling from, where you're dialing in from, and then you could tell us your comment or question, please.
Yes, hello.
Yes, Frederick, I can hear you. Frederick, your hand is still up. While Frederick is trying to sort himself. Somebody just asked me a very simple question. He says, how many pages does the new standard have? And let's see how many pages the new standard has. I'll show you in real time while we're waiting for some people to come up with their questions. The new standard has, yes, only 56 pages. The old standard had 54 pages. So it's not very much different in terms of pages. So this is what the table of contents looks like for the new standard. That's what it looks like for the new standard. And again, I didn't go into all the details of what is listed here. But yeah, it has 56 pages. So it's not so much different from the old standard. I see a couple of hands up. Yes, please. Who am I calling now? Kumi Hospital. Who is in Kumi Hospital? Kumi Hospital. Could you unmute and then go on? Kumi Hospital, I cannot hear you. Joseph, are you ready to go, Joseph? Yes, please. Joseph, go on.
Yeah, thank you, Professor.
Yes, please.
This is Joseph from Kakumero district.
Okay.
Mine is not a question. Mine is not a question, but it is an appreciation. Thank you. Professor, thank you for always informing us when such a new ISOs are on board or out. Because I remember there is also an ISO which is a 35001 about safety in labs that you gave us, and it was quite a new ISO which nobody of us, none of us had ever seen. And so it is again an appreciation that you are informing us of this ISO, which is a new edition 4. Thank you very much.
Thank you, Joseph. Thank you. And you mentioned a very important ISO, the 35001, which actually brings together biosafety and biosecurity. That's especially in today's medical world, that's a very important ISO document to work with. I'm going to go on to Frederick. Frederick Kigongo, you're signed in twice and you have 2 hands raised up. I'm not sure which one you're going to use, but please mute one of your devices. Otherwise, we're going to have a big screen. Frederick Kigongo, please unmute one of your devices and speak. Frederick is having a challenge. Frederick, what you could do, you could type in your question in the chat box, and my technical team will be very glad to read it and bring it over, and then we could go on. I also have somebody from Kumi Hospital. I'll give you another chance. Somebody missed out on my, yes, it's the ISO 35001. ISO 35001 brings into relationship the biosafety and biosecurity. That is the management standard that is used in relationship with the ISO 15190 for medical laboratory safety. So the ISO 35001 is the management standard, and the ISO 15190 for medical laboratory safety is actually the implementation document. So you bring those 2 documents together and you have an excellently secure and safe environment to conduct your medical laboratory or scientific practices. 35001 is. Okay, a couple of questions coming in. For accreditation purposes, are there completely new requirements that labs are expected to implement according to the, this is a draft standard. So it's a draft international standard, the new ISO. There's good, as I said, one of the things we're going to be glad to work with you on is the new alignment. And I mentioned 1 or 2 things that are actually expunged from the 4th edition that were originally in the 3rd edition. So those kinds of things would have to come out from your documentation, from your standard operating procedures. Something as clear, this has been a question for a lot of people in the lab. Do you do verification or do you do validation? In the new standard, it is very clear. It says verification of processes, and then it talks about validation of methods. And then, so that is very clear in terms of what you're going to validate and what you're going to verify, what you're going to do verification on, as opposed to the other standard where it just spoke about verification, validation, and measurement of certainty. In this standard, that is well addressed and well taken care of. So in terms of that, there is a question about the application of the standard at the regional level, clinics, national laboratories, reference labs. This standard is intended for medical laboratories. So once the appellation is given to a site of testing as a medical laboratory for in vitro testing, this standard suddenly becomes applicable. Yes, there might be sections of the standard that you might not be able to, that might not be applicable at a health center or at a district level, but then you would have to say that in your operating manual. And that's why the presentation of this standard, again, when you think about clause 8 in the ISO 9001, when you think about clause 8 in ISO 9001 and you relate it to the element of operations in this new edition, you can actually begin to see what you need to reference or what you need to speak to in your standard, as opposed to leaving it out and why you leave it out. Could you please tell us more about what subclause 8.2 management system documentation, given the fact that document procedures and quality manuals will no longer be required? I never said that your quality manual is not going to be required. I never said that. But in terms of the management system documentation, that would be a compendium of what would constitute your quality manual for your management system. What is the impact of this ISO clause on the quality management system? In essence, what happens when you have the technical committee meeting and going through a process like they're going through now is the standard has been out there and people have used the standard. So what you have is experts in the field, including yourself and myself, if you are in Kenya or Uganda or in Botswana or in Cote d'Ivoire or one of these countries, you would be speaking to the standards bureau in your country and providing them with information so that should they be members of the TC212 or can they forward your concerns to the TC212, it will be taken into consideration as the new documents become available. So there was a period when this particular standard was circulated, and we at the foundation had the luxury of actually seeing it and providing some kind of insight. We do not belong to the standards body in any of our countries, but we have relationships with standard bodies in many countries. As I said earlier on, we're in 16 countries on the African continent. So that allows for our position to be heard from multiple avenues and multiple points. And basically in receiving this information, the TC212 is able to synthesize this information, analyze it, and decide on what kinds of changes are going to be appropriate for a subsequent revision of a standard, in this case, ISO 5189. Let's see, I hope I've answered all the questions. A few more coming in, thank you. What is your take home for labs that are seeking to apply for accreditation next year? There is one standard that is out. There is never going to be a time when you have two standards available. Right now, the standard that is out is the 3rd edition of the ISO 15189. It's a published standard. Its nomenclature would be the 6060. It's a published international standard. So you would have to prepare for your accreditation with the 3rd edition. Should you, at the time of the assessment, there is a new standard, your accrediting body is going to advise you accordingly. At the time of your application, if you apply to the 3rd standard, which is going to be the criteria for your accreditation, your accreditation is going to have a criteria, which is going to be ISO 15189 3rd edition. At the time of your accreditation, that's what you'll be presented with. At that time, your accrediting body would advise you on how much time you have to transition from the 3rd edition to the 4th edition. So that's something you could either start working on now, or depending on how far out you are, if you've already made your application, I would suggest that you go on and get your assessment based on the 3rd edition, but you might as well start thinking about your transition because your accrediting body will surely ask you to transition from the 3rd edition to the 4th edition, most probably before your annual surveillance. It wouldn't be before your 6-month surveillance, but it will certainly be before your annual surveillance. When is DIS going to be effective? As I said earlier on, the DIS document is right now in its 4th of 6 stages. So the voting is going to be over on January the 11th, January 2022, the 11th. And once it gets into the final draft international standard and the voting is done, then we're going to be moving into review. And from the review stage, the next stage after that would be the publication of the international standard. That is when it gets to 6060. And that's all I have right now from the chat box. I thank you so much indeed. I think we are now at the top of the hour. Again, it's always my pleasure to have these discussions with you and to continue to talk about elements that are good things that are happening with these international standards, not just ISO 5189, any of those standards in the element of healthcare and other industries. Is there any plan for enrolling healthcare health center force for accreditation using this new ISO? I'm deeply sorry, I don't have a clue what the answer is to that. As the Agqc group of companies, our job is to provide consultancies to whoever presents themselves for an accreditation process. We do not make decisions on who should or shouldn't present themselves. So I would not know how you enroll health centers or district levels, but we would, if we are called on, as I said earlier on, we have worked with 16 different ministries of health on the African continent. We'll be very glad to provide guidance to the different ministries of health on what they could do or how they should do what is best for them as they develop and implement a quality management system for the different countries. So I thank you so much indeed for coming. We would stay tuned. We would gladly like to listen to you, hear from you. You can please reach us at info@agqcon.com. You could also give us a call, meet us on Facebook. There are a number of ways you could contact us. We'll be very glad to be in that conversation with you. And I thank you so much for today. Have a wonderful rest of the week and see you at our next presentation. Thank you.